Dr. Leo Morales, welcome.
Thank you, Enrique and Matt. I'm glad to be here. Thanks for inviting me.
Well, we really appreciate it. Well, let's start with this. Tell us a little bit about your work and how the pandemic impacted what you do.
Sure. Well, it's changed my life, essentially. I think as I became aware of the pandemic becoming, well, identifying it as a pandemic, and then also seeing very early on how there were differential rates in testing, identifying cases initially in our state and in our region. Um, Particularly, I was concerned about the negative impact or the lack of access to testing among Latinos in our region. I really pivoted my work and my attention to initially identifying cases, testing, and more recently vaccinating, um, and really focusing on community-based organizations and working with them, understanding that the healthcare systems were excluding many folks who needed the services that were being provided.
Of
Well,
course,
it, the
all of this is something that communities of color have had to deal with for so long. So I found it interesting that it was almost like people were, amazed that they're finding out that there's these disparities, but really that they've been there.
Absolutely. So this is nothing new, and it and in fact, we've in my office we talk a lot about social determinants of health and a historical perspective, really, based on issues of discrimination and racism that have existed in the country for centuries. And so all of those historical factors play a role in creating the circumstances that we see playing out with COVID-19. So absolutely nothing new. And in fact, one of my early concerns was let's not be too targeted about our approach here, because you know what? This pandemic is going to come to an end, but the health disparities that are in these communities will continue to exist. So let's not just be here for this. Let's be here for the long haul, and let's be here to solve the health issues that are in our communities.
so has there been an impact made in the Latino community from when the pandemic was identified as a real threat to everyone to where it is now?
So, I mean, I think the one thing I've seen that happen that I think is fantastic is the community has organized itself in ways that it wasn't before the pandemic. So, in our area, there's been the formation of the Latino Civic Alliance, for example, which is made up of a number of different community-based organizations throughout the state, and they really came together to address COVID. They've been there. They're grassroots organizations and slightly bigger ones, some 503c, some not. But they've come together and they're starting to talk to one another, and they're collaborating. And I think that's a very positive outcome. Now I'm hoping that we will continue to have those sorts of coalitions and working together to solve, different health problems.
Is there still a hesitancy in communities of color to get the vaccine, or was it mainly access and education?
Yeah, that's a tricky question. I think that, I think the hesitancy, there are perhaps different reasons for hesitancy. And so, some of them could be around issues of concern around cost, and issues of concern around protections, legal or otherwise. Some of them could be because people are concerned about, whether the vaccines are safe, whether they're effective, whether they're necessary. I think in the Latino community, and there was some recent data that came out of the Kaiser Family Foundation that showed of those Latinos who are unvaccinated and ready to be vaccinated, something like 50% were saying they were concerned about the costs. And so, there's a lot of misperceptions out there. I'll say the other big factor I think is breakdown in trust between public health, any sort of governmental organization, and communities, Latino communities in particular, because of all the issues of around immigration and concerns about deportation and, families with mixed statuses and real concerns about approaching, anybody who wants to collect information and works for the government. And that has been a huge barrier.
Yeah, and it kind of peaked during the last administration.
Absolutely. And that fear and that chilling effect has had, it continues to have an effect to this day. I can give you an example. So, we had through the state, we were able to access National Guard resources to go vaccinate. They were well resourced, they were available, but many communities rejected their assistance, just out of fear, out of what it meant to have a uniformed individual in the community, even though they were there only to vaccinate. So people delayed, and delays in vaccination means lives and health, and so it's a real cost to that lack of trust.
Was that a combination of what they experienced, not only in worrying about their immigration status and all of those things here, but what they experienced in their own native countries, where there's so much corruption, and you have to fear the police or anybody in a uniform?
Yeah, and I would assume so. I don't know that for certain. It makes sense to me. It's unfortunate that now our government is viewed like governments in Latin America, which are, you have to be fearful of them because there's so much corruption. I certainly, I can't, I don't know for sure, but I would guess, yeah, some of that's probably working.
But more than anything else, it was the rhetoric that we heard in the last 4 years.
Yeah. And, there were a lot of missteps. So at one point in our state, I think law enforcement was sharing information with ICE, and that was stopped and condemned, but the damage was done.
Yeah.
And so that creates fear, and it's not unjustified fear, but it's very hard to change that once it's there.
So what was done to change that, so that those communities, so the people in the community could then feel some sense of safety, but also that they needed to get this done? So at the grassroots level, what had to happen?
So, the reality is, I think the only approach that works is really to work through the community-based organizations that have the trust, that have been in the community for a long time, that have personal relationships. And so that's really been the way. So I'm working with another professor in information school whose name is Frank Martinez. We've created a project called Adios Covid, which I love. Adios COVID. It's like, Adios. I love it.
Get the hell out of here.
That's right.
Yeah.
Enough. Basta.
Yeah, really.
But so, and our approach has been simply to fill the gap between, larger institutions that have resources and small community-based organizations that need them. And in particular, the efforts around initially testing and then vaccines. Because I think they're really the only ones who can reach these pockets of the community that are hard to reach. They're substantial in size. They're not connected to healthcare systems. These are people who are not necessarily insured, or even if they have the potential for being insured, don't seek it and don't seek out healthcare. And so because of concerns around cost. And so the community-based organizations, I think, are key, and it's really about us going to them. So healthcare organizations are, historically very passive. We open the doors, but we don't really do much to bring people in those doors, outside of some very targeted marketing that's not targeted to the segments of the population we're talking about. We need to be in the community. We need to be present there. And so that's really been the efforts of Adios COVID, has been to be present in the community, work with those small organizations, and make vaccines more accessible.
Right now, Mayor Durkin has taken a victory lap, saying 70% of the residents in Seattle have been vaccinated. That may be true, but I got to think the disparities don't tell the truth there.
Yeah. So yeah, you got it. So, there's a, these are small population problems, right? So what's true for the average is not true for different segments. And, we know, for example, in King County, 50% of Latinos and African Americans are vaccinated compared to the whatever it is, 60, 70% of the non-Hispanic white population. In our state, there are counties that have vaccination rates in the 30s. So, which are largely Latino counties in Eastern and Central Washington. So, I'll tell you another little story. So one thing that we saw very early on with testing, or actually with infection rates. So if you look at the average infection rate, like what IHME, the Institute for Health Metrics, was publishing these rates, right? You saw these graphs with infection rates going up, and then there was the institution of stay at home, and the rates started to come down, and then it was lifted, and they kind of stayed low until the next surge. But if you disaggregate those infection rates by race, ethnicity in our state, Native Pacific Islanders, Native Hawaiians and Pacific Islanders and Latinos the surge did not stop with stay at home. In fact, it accelerated during the whole period of stay at home, during the whole period of shelter in place. They actually didn't start to come down until after shelter in place was lifted. So if you didn't look deeper, the story you would tell is, well, this worked and everybody got better. But no, in fact, some people, we don't know. I wouldn't go as far as to say these populations were harmed, but they certainly were not helped. And that has to do everything to do with who has the privilege of being able to work at home and not go to work, or participate in shelter in place. And for these communities, it did not show up that way.
How much did multi-generational households play into that?
I'm sure that's a factor, right? So, where infections take place mostly is in the home. That's what we learned in the pandemic. So a lot of the spread actually happened within households. And if you have a multi-generational household, it's especially where you have smaller houses. So there's more dense, family living. You can't really avoid each other. You can't really, the idea of isolating, quarantining within your house is really, if there's one bathroom and 8 people, that's just not a reality. And so there was a lot of transmission in households.
So where are we now with vaccinations? I mean, as Matt pointed out, the mayor's touting that 70% number. You point out the fact that if you look into the kind of specific populations and communities, not so much. How then do we get those folks up to 70% or beyond?
Yeah. So our big concern, and I say I mean Frank Martinez and I, who have been working on Adios COVID, is that June 30th is the date when everything goes back to normal.
Right.
And we're not anywhere near being done with communities of color being vaccinated. And our real concern is that the attention will be lifted, the message will be sent that we're done with this, and any sort of momentum in terms of vaccinating communities it'll evaporate, or it'll be very much harder to do, as will the funding and other resources that are currently mobilized may, become scarce. And so, this is not a problem that's done, and we have a long ways to go. I mean, within King County, which is a well-resourced, county, it's 50%. That means half of Latinos, and we haven't started with the younger, less than 12-year-olds, which will happen in the fall, or early next year. We haven't even started with them. And with a group that we're currently vaccinating, 12 and older, we're only at about 50%. That's still 50% of people that need to be reached. And so the hard work needs to be done.
So what do we know about Central and Eastern Washington, where you have the agricultural community and the people that are working in the fields that we depend on?
Absolutely. And that's some of those counties I have not been able, we don't have access. Don't have access to race ethnicity specific data by county, but we know that some of the counties that have low vaccination rates are 60, 70% Latino, and they have low vaccination rates. They're not as big a part of the population because these are sparsely populated counties. So if you look at the statewide average, that's going to be driven by Seattle, King County, Pierce County, Snohomish County. But within those communities, the vaccination rates are low. And so you can presume that, I think accurately, that the vaccination rate among Latino communities in those counties is going to be also low.
So, what's the world going to look like? Because there's going to be the vaccinated and the unvaccinated, or as one doctor said, the vaccinated and the infected. What I've read lately is that the infection rates, the death rates, the hospitalization rates are as high as they were in January in unvaccinated communities.
Yeah. Yeah, there's some interesting dynamics in terms of, that, well, just for example, even though the absolute number of deaths is coming down, but within certain segments of the population, you still see fairly high infection rates. And, I guess the way to understand that is, older people have been well vaccinated for the most part. I'm not so sure. I have not seen a breakdown of race ethnicity by age to know for sure what's going on in Latino communities in terms of the elderly. But nonetheless, the risk, I think, is going to change. So what are the risks to getting infected when you're younger? I think the long hauler issue still needs to be elucidated. So even though mortality rates are coming down, getting infected has health impacts. And some of them may persist for months or longer. And that's only now being understood. So younger people, they're not going to show up as a concerning statistic in terms of mortality or hospitalizations, but the longer term health effects, whether it's persistent effects with memory or heart effects or lung effects, are not yet clearly elucidated. So my concern is, there's going to be an invisible part to this that we're not going to see for a while. And because people continue to get infected and are unvaccinated.
Are we going to have a surge in those communities? I mean, because there's states where they're just vaccine resistant because of politics and whatever. But I mean, they're gonna keep infecting each other, right?
Absolutely, yeah. And so what's going on right now is we're having good. I mean, clearly the vaccines are having an impact in terms of infection rates. Seasonality is having an impact. So we're in the lower season right now for COVID and all, like influenza virus as well. And, so we're watching surges happening in South America, the southern continent, where they're in the winter. And so we don't know what the fall is going to look like. And in communities where there's a lot of uninfected people still that are unvaccinated, we can see a rise in the infection rates again, and we probably will. It's probably going to be smaller groups of people. It's probably going to be isolated in communities that have low rates of vaccination. And of course, there's the issue of the emergence of variants that may be more infectious and more resistant. So this is going to turn into, we need to get a booster out there following on the vaccines we've currently received. That's going to be the next step. And so
you think that's inevitable?
I don't know for sure, but it sure looks that way. I mean, it stands to reason, that we're going to need to continue to adapt our vaccines to the emergence of variants that may be more problematic.
As you see things opening up right now and people getting out and socializing again, getting in bigger groups and all of that, what is your reaction? I mean, do you have this sense of, okay, yeah, that's great, and I'm happy to see it, but like you're maybe holding on for dear life, wondering if something's really gonna, you know what I mean?
I mean, it's really hard to know. I mean, if I feel safe, I'm vaccinated, right?
Yeah,
so
me too.
I feel okay. I'm like, all right. But I worry that, that we're going to see more people, like you said, perhaps more infection especially among those who are unvaccinated, who are going along for the ride, thinking everything's okay. We haven't reached a state of so there's a couple of factors that influence safety, right? One is whether the proportion of the population that's been vaccinated. So the more a community is vaccinated, the less circulating virus there is, the less likely you are to get infected, whether or not you're vaccinated, right? 50% we're not just a homogeneous community. We're kind of little pockets. And so within those pockets where there's less vaccination, there's going to be a higher risk of more infections and, deaths and morbidity associated with long-term effects of COVID.
Do you fear that government officials aren't concerned enough or taking seriously the need to address what's happening in communities of color, especially since the numbers are different?
I do. I think everybody's ready for the parade.
Yeah.
And there's a lot to be happy about.
Yeah, but they may be ready for the parade, but for us and our communities, that means that we're in the back. We may not even joined yet.
Yeah, that's right. And so I worry about that. Definitely. I think, we're not done with this. And, on the one hand, I understand the desire to get back to normal and celebrate. We have fantastic vaccines, new science that has made it possible. And we have vaccinated a lot of people in a short period of time. But for communities of color, there's still work to do, and we're not done with it. I don't think we should be celebrating completely until we've really vaccinated everyone, right? We need to get everyone vaccinated. All communities need to have take advantage of the benefits of these vaccines, have that opportunity.
A lot of people like to ask health officials and doctors, like, how do you conduct yourself in your daily life now that you're vaccinated? So what's your life like? Do you go out to restaurants? What do you do?
Yeah. Well, and again, this is me. So I don't want to say this is appropriate for everyone. I wouldn't want, I don't want to say that what I do is necessarily best for everyone. Here's what I do. I wear a mask when I'm in spaces with other people in close spaces in buildings. If I go to a grocery store, I wear my mask. And part of that is just to promote a sense of safety for people who may not either be vaccinated or even be vaccinated, but still be vulnerable, because they may have immune deficiencies, they may have cancer. There may be things that prevent them from, fully being advantaged by the vaccine. So I'm still doing that. But I'm in my family, we're all vaccinated and we don't wear masks. I have an 82-year-old mother, that we were part of her pod. Now she's vaccinated and she can see other people. I feel comfortable with that, who are not in our pod. And we've socialized with her without masks because we were sort of staying socially isolated. But so that has opened up. So I would say, it's different. It feels better. I never really thought it was necessary to mask outside, but now I feel socially safe doing that. So people don't think it's weird, you can't really get this stuff if you're just walking around, unless you're very tightly packed.
Common sense.
Common sense.
Like, yeah, which we are in need of. So, as we talked earlier, you pointed out that, and maybe I pointed this out for you, is that our disparities have been there. And you also said that you're concerned that we're going to just lose the focus about all of that.
Yep. So the analogy in my mind is, there has been in international work this debate between what they call horizontal and vertical interventions. So let's go eliminate polio. So you go in and you vaccinate everybody for polio and you only focus on polio and you eliminate polio, but malnutrition is still there. So people are dying of other things now, So you took care of one narrow problem, but you didn't build capacity and you didn't address the other conditions that are affecting health, right? You took care of one very narrow thing. And I would say the same thing with COVID. Like right now, we're laser focused, and there's some sense to that urgency and need to do that. On the other hand, those conditions that create, those health disparities are still there, and it leaves a bad taste in communities if you're just there for one purpose. Like if we show up and dump a bunch of resources, it's about making ourselves safe, not about improving the health of communities. So we
Good
we
point.
need
Yeah.
to
Yeah.
we need to invest in those communities in a long, sustainable kind of way that will lead to better health for all the different issues that are operating there, whether it's mental health issues or diabetes or hypertension, all the killers.
Yeah, which exists in all communities. So
And they disproportionately exist in communities of color.
if
Hey,
you
man,
had,
you think if the underlying comorbidities weren't as pervasive, that maybe COVID wouldn't have had such a large impact, because it's sort of a pandemic on top of a pandemic?
Yeah, absolutely. Yeah. Fertile ground for badness to happen is, having chronic conditions. So if you look at mortality rates, they're higher for communities of color, in addition to infection rates. So the mortality rate per 100,000 is higher. And that's got to be due to pre-existing conditions.
okay, Doc, I'm going to give you a soapbox here. And if you were speaking to the president and others that have an impact on our lives at the top of the food chain, what would you tell them, particularly when it comes to communities of color dealing with COVID, but also as we talked about these disparities?
I think, our country needs deep reform. We need to really invest in communities that are suffering from COVID and suffering from these health disparities. And I would, and I'm thinking about things, not just access to healthcare, but yes, every person there should be universal access to healthcare. There should be I never understood why people ask for insurance cards for the vaccine. Like, why would you do that? Like, who cares? Like, vaccinate people, right? Give them the healthcare they need. It should be universal. Education. We can't have two systems or more of education. We need to give opportunities to young people. Communities of color are where the young people are coming from right now in our country. We need to educate them, and that will lead to good health. In so many ways. The dirty word is redistributing income. In my mind, it's really about investing our communities, but we need to get rid of the wealth gaps that exist. We need to address that and reinvest in our communities of color in particular, which are so disadvantaged right now. It is tough out there, and people are just holding on. And it shouldn't be that way in such a rich country.
That's for sure. Well, Dr. Leo Morales, thank you so much for your insights. How about in about 6 months, you come back and tell us where we're at? No, seriously.
I would be glad to. I would be
Yeah.
happy to.
Or
Yes.
sooner, you tell us, when's a good time to reconnect, to revisit things, because we definitely want to keep an eye on this, particularly since the work you're doing is focusing on those communities that really all too often get ignored, and we can't do that anymore. So yeah, it pisses Matt off. So
Yeah, it pisses me off.
Yeah, I know.
That's why this whole victory lap thing really just kind of irks me,
Yeah,
because we're not there.
We're not there.
actually, it pisses me off too.
But I think what you said, they do that to make themselves feel good and feel safe.
Yeah.
So that's where it needs to start.
All right.
Thank you, Dr. Morales, so much.
Thank you both. And I really enjoyed speaking with you.
All
Take
right.
good care.
Thanks, Doc.